at the time I remember thinking, how do you come back from this? And we came back from that. You all remember how dark it used to be at the Embarcadero. And we took what was a tragedy for our city, and we created something amazing and something beautiful, light and hope as a result of the darkness. And that's the same thing that we're gonna do as a result of this pandemic. You know, we are here in this community opening yet another site because the people of this community, and in particular, the Latino community, they have been the hardest hit by this pandemic, not just in San Francisco, but in this state. So when you look at equity and you talk about who is most impacted, the Latino community representing over 12% of the population, yet over 40% of those who were diagnosed with COVID and over 20% of those who passed away because of COVID. The Latino Task Force and a number of organizations in this community, they met with me, and the stories that I heard were very heartbreaking because we as a city thought that with some of our programs, our recovery and resources we were providing to workers and rent relief, we thought it was enough. We thought we were doing what we were supposed to do, and we were wrong. We were wrong because the community was on the ground doing the work, and they were helping and serving people, and they were dealing with serious challenges, and the numbers did not lie. The numbers demonstrated clearly we weren't investing enough. And so with the help of our Department of Public Health and HSH and other agencies in the city and Supervisor Ronan, the supervisor for this district, we came together and we found the resources to invest an additional $29 million in this community in particular. And this community stepped up and did even more work than they were doing before. The Food Hub, and I see Roberto here, Hernandez, thank you so much for your work with the Mission Food Hub. The Latino Task Force with John and Valerie and so many volunteers who were opening up not just testing sites, but also these new vaccination sites. This was possible because of this community. This site is possible because this community came together and made it possible. So when I think about the early dark days of this pandemic, I can't help but be excited about the future of our city because of the people of our city and how we have looked out and uplifted one another through one of the most challenging of times. So we are in a good place. And I know I'm here today because we're kicking off another vaccination center. I know that we have to meet people where they are and make it a lot easier with no appointment necessary, because I know my family. They do not make appointments. They say, where am I supposed to go, right? Some people may not have access to the internet. They may not, but word of mouth, when you hear about a place to go and it's easy and no one's gonna ask you questions about your immigration status or anything else, and it's easy for you to do it, you're gonna do it. And let me tell you, I am so proud of this city. We are still leading the effort. Not only since the beginning of this pandemic have we had some of the lowest rates of any other country, the lowest infection rates and the lowest death rates, even though we are one of the densest cities in the country, we have been able to vaccinate over 60% of San Franciscans who are eligible to be vaccinated. And almost 85% of those who are over the age of 65. Think about it. Even with the challenges of supply, and one of our goals was to do 10,000 vaccines each day, and we've been meeting and exceeding that goal, even with limited supply. And we've been doing it because the Latino Task Force and other organizations have been providing these pop-up locations to make it easier for people to get access to this vaccine. The state doesn't even come close to our numbers in terms of vaccinations, and the national average is even lower. So San Franciscans, we have something to be very, very proud of. We have one of the lowest hospital rates right now than we've had since the beginning of this pandemic, and we are finally seeing lower numbers since last year in April in the Latino community for the first time since this pandemic began. But that means we don't let up. We go harder. We go stronger. We keep moving forward. Because I want to be able to show up at a press conference and see people without masks eventually. I want to be able to show up to an event and have a good time. I want to hear singing and performances. I want our kids back in school. I want our places of business open and thriving. And there is no question that all of you want that too. So the last thing I want to say is, make sure that you have the hard conversations with your family members, because it's so important that they get vaccinated. Let me tell you, and let me just be honest, for African Americans, for my family members, it's been some hard conversations. I ain't gonna get that, I don't know what's in that virus, whatever. And what I say to them is, what I'm most concerned about, because especially the conversations are with a lot of my elderly family members, what I say to them is, the chances that you will die if you get the vaccine are slim to none. But if you get COVID, the likelihood that you will not be here could seriously be likely, because many of my family members have underlying health conditions who are older, and I don't want to lose them. That's why I got the vaccine, to show them that if I can get it, you can get it too. So let's have those hard conversations with our family members. I'm not a doctor or expert or can explain all the nuances, even though I'm like, doctor, as soon as they ask me a certain question, I'm texting Dr. Colfax and asking him, my mama said this, what do I do about that? I know you all can't text Dr. Colfax, but the fact is, you can point to examples of people that you know have gotten the vaccine and try to convince your relatives, your family members, because what this means is less people dying in our city. That's what it means to me. And that's why we have an obligation to do everything we can to get everyone vaccinated as soon as possible. And we are doing our part to open these local sites to make sure that it happens and it's more efficient than ever. So thank you all so much for your work, and thank you all for being here today. And at this time, I'd like to introduce the supervisor for this district, Supervisor Hillary Ronan.
Oh, thank you so much, Madam Mayor, for leading us through the hardest year of our lives. Thank you. I don't know about you all, but I'm looking at all of your faces and the weight of what we've been through together has hit me quite hard. Everyone here, from the Latino Task Force, Susanna, Valerie, Tracy, John, Roberto, so many of you have worked nonstop since day one. I look at Mary Ellen Carroll, the head of our Department of Emergency Management. Can we please give her a hand? This woman, you have to drag her on like a one-day vacation if you're lucky. She'll go. We have to take her phone away from her and hide it. Dr. Colfax, oh my goodness, you have just been at the helm and keeping us safe as much as you possibly can from day one. Thank you. I look at Dion Jones, a nurse who helped create the response to the first plague that San Francisco survived, the HIV/AIDS plague, and was here from day one to get us through the next plague. And Dion, thank you. Thank you for everything you've done. The press, you guys have been out here from day one, keeping us informed, putting your lives on the line. I mean, I look at all of you, and we've all been doing this since day one, and I just have to start with profound gratitude towards each and every one of you for how you've gotten us to the point we're in today. And the point we're in today is we are on the way to beating this thing. And it's because of sites like this. And Dr. Colfax and Madam Mayor, thank you. Two in the mission, two in the mission, on each side of the mission. It's because of places like this that we are on the way to beating this disease. And let me tell you, I got my second shot at the CAP and 24th location on Monday. And this is similar from the other standpoint to what our mayor was telling us. I was the only white person there. And I have never been so happy to be the only white person anywhere. Everyone around me was speaking Spanish. They were from the community. In many cases and instances, they were dragged to the site to get vaccine from members of their own community. And I thought to myself, this is the reason that we are leading the nation in terms of numbers and beating this virus. And so thank you from the bottom of my heart, Unidas en Salud, DPA, Madam Mayor, my colleague on the Board of Supervisor, Matt Haney, who's joined us here and has been informing people how to get the vaccine more than perhaps any entity. I think you tweet like 10 times a day where appointments are available. Thank you for your incredible work doing that. And I just want to say, like the mayor, we are this close to beating it, but it'll only work if we get every single one of us to get this vaccine and to do it as soon as we can. Thank you. And thank you. And with that, I want to introduce a hero of mine, the Director of the Department of Public Health, Dr. Grant Colfax.
Well, good morning. Is it still morning? Good afternoon? Whatever. It's a beautiful day. Yes, thank you. And thanks for the kind words. And it's wonderful and inspiring to be at this site. And I just want to say, first of all, thank you to the Latino Task Force and others here today for showing DPH the way, for teaching us how to make this right, how to continually improve, and our evolution and transformation together is what got us here today. So thank you very much for helping us do this right, for helping us learn how to be humble, respond to community, invest in community, and make the partnership with community leading the way and DPH following. Thank you, Mayor Breed, for your leadership, and thank you, Supervisor Ronan, for your leadership. And I want to express my gratitude again to the Latino Task Force and your help in having us develop comprehensive, culturally competent prevention, education, outreach, testing, contact tracing, all of these things, this comprehensive, what you determined and helped us establish, the low barrier work, that every door needs to be the right door. The bureaucracy wasn't always the right door at the beginning of this pandemic, and I acknowledge that. But we adjusted, we learned, and we evolved. And that's why we are here today with 60% of San Franciscans eligible for vaccine, having gotten at least one vaccine. Our case rates are, as the mayor said, about as low as they have ever been. While the Latino population represents 14% of the city's vaccine-eligible population, it has accounted for 26% of DPH's vaccinations. So we are doing relatively well there, especially when compared to other vaccines across the city, where Latinos represent only 12% of recipients. Again, emphasizing the need for these neighborhood access sites, low barrier drop-in. The city's dashboard also shows that for DPH vaccines, the neighborhoods with the largest number of vaccines received are the Bayview, the mission, and the Excelsior. And we know that is so key, right? Because that's where COVID has been. So on behalf of the whole department, I want to thank you all for your work and the incredible effort of this accessible network that we've developed, this ecosystem. Certainly hasn't been easy. It took some difficult conversations. We've had some Zoom calls and team calls, but we're there. I also want to thank Ramon Hernandez and the members of Local 261 for allowing us to use this facility. It's an amazing spot. And thank you, of course, to our DPH team, including Dr. Fuchs, Isella Ford. Isella, where are you? Oscar, on the ground every day about, right? David Leva, where are you? Yep, there you go. Fantastic. And of course, Supervisor Ronan, Supervisor Haney, our new Assessor Recorder Torres, and Director Carol, my partner, 24 hours a day in terms of making this work. So as you know, vaccine supply remains limited in San Francisco. And with the expansion of people eligible being 16 and above citywide, city appointments are going to be challenging, but I'm delighted to see people walking in here. This is the right way to do this, and we need more vaccine as quickly as possible. 12,000 a day going into arms now, an ecosystem of 20,000 capacity. We're ready to go here. We just need more. And we need to stay vigilant. These variants continue to be of concern. We're watching what's happening in Michigan and other parts of the country where cases are going up. Let's continue to wear those masks, socially distance, get your family and friends to get the vaccine as quickly as possible. Otherwise, we will be in this longer. The sooner we get more vaccine to arms, the better we will do. The sooner we can get back to our new normal, celebrate, and we can have this press conference with all the masks off. Thank you so much.
Thank you, Dr. Colfax, and I want to introduce, well, she needs no introduction, Valerie Toulier. Thank you so much again for being here. She really is the mother of this community and has just been doing an incredible job in getting all of these great places set up to support the community. So come on up, Valerie.
Thank you, Mayor, so much. I want to thank the Red Lightning Women Power Group for singing and opening up for the mayor this morning, and also to Sharia for opening the land acknowledgement. I do want to acknowledge the ancestors of this land, and may their spirits bless and protect us. Thank you to my mayor, all right, okay, our mayor, for being with us today. I'm very, very possessive here, territorial. And every single city official. You tell us that you see us and that you see the community's hard work and dedication. And for that, I appreciate her leadership. I don't think it could have happened under any other mayor than Mayor London Breed. Now I feel like I'm gonna go into an Oscar acceptance speech because I have to thank everybody. But I definitely wanna thank the Latino Task Force for being exactly that, a force. Yes. All of the organizations that are involved, all the individuals, and all the committees. What you see here is just a glimpse of the hard work that the Health Committee puts in. What you don't see here today is the hard work of 14 other committees, actually 15 if you include the Executive Committee, Tracy, Roberto, Gloria, and Gabriela. Also on my list are UCSF, BAPLS, absolutely Local 21, the Labor's Union, who is really ironic because where our hub is, the Latino Task Force Resource Hub on 19th and Alabama, was their original home, Centro El Obrero. And now they've moved here, and guess what? We followed them. All right. And they opened up their home. In the Latino culture, we have a saying, mi casa es tu casa. So they have welcomed us. Their home is our home. Special thanks to DPH and all the city departments who have learned to dance with us, like COVID Command Center. I know that it has not been easy. We did a lot of stepping on each other's toes in the beginning. John and Susanna have been my partners in crime, although they would like to kick me sometimes, but it's okay, they forgive me. Today's community vaccine hub, like the one in Excelsior, shout out to Excelsior back there, Patty, I see you, shows the community that we love them, we respect them, that they can trust us to take care of them with dignity and compassion. Thank you to the media for being here. You are not fake, you are real. You do not always get publicly recognized for being here to tell our story, so thank you for being here. So in closing, I just want to acknowledge that there's Olga from another union. We want to make sure every single union member is vaccinated. Dr. Fuchs, Josh Arce, Joaquin Torres, Supervisor Haney, everyone that's here. And forgive me if I don't call your name out individually, but just know that I love you and I appreciate you. The Latino Task Force loves you and appreciates you. Thank you so much. Thank you.
Thank you, Valerie, and thank you for recognizing Olga Miranda from Local 87 SEIU. Olga, thank you for all the work you and your members continue to do to take care of this city. All right, so that ends our press conference. I know that most people who showed up today didn't think, when they showed up today to get their vaccine, didn't realize that they might be on camera, so we apologize for getting all in your business, because you know how folks are about people in their medical business. I know I don't want everybody in my business, so I totally understand that, can appreciate that, and so thank you everyone for the hard work and what you have done here today, and let's continue to get vaccinated, let's continue to take care of one another, and let's get through this so that we can throw off our masks and throw them in the air and wave them like we just don't care eventually.